I'm okay. My toe is just killing me.
Oh, I'm sorry to hear that. You're Mr. Rogers, and my name is Natalie. I'm the pharmacist at the pharmacy here, and I'm here today to talk to you about this medication that you'll be getting to help with the pain with your toe.
Okay.
So you're Mr. Rogers, and this medication is for you. You'll be using this medication. And this medication is called indomethacin. It's gonna be, it can help with your gout. And before I counsel you on this medication, I'm just gonna ask a couple questions about your past medical history and your medication history. Do you have any past medical history?
Um, Nothing I can really remember right now. I'm on cholesterol medication. That's about it.
Yep, I can see it on your medication list also. And are you allergic to any medication?
No, not that I know of.
Okay, and I'm gonna ask you a couple questions about the pain in your toe. Did you try anything to help with the pain?
Um, I don't. I really haven't had any chance to take anything for it yet. I think in the past they've given me some Tylenol for it, but that's about it. Like it's just so bad right now.
Oh. What brings on the pain?
Just sort of doing anything. Like all the time. It's pretty bad, and then just like sometimes just like it's like a flare up and just kills.
Right, understand that. So from 0 to 10 on a pain scale, how would you rate your pain when you're sitting and when you're like doing activity or walking?
It's like 5 or 6 out of 10.
Mm-hmm.
Just like it keeps me from really enjoying things.
How would you describe your pain? Is it stabbing you? Is it burning?
I don't really know how to describe it. It's right there in the toe. It just hurts a lot. It's just really intense, sharp, I guess.
Okay. Does it come and go? Does it radiate to other parts of the body or just localized to your toe?
It's just the toe.
It's
just the toe.
Okay.
Yeah.
Yeah, so you mentioned that it affects your activity level. But don't you worry. So this medication that your doctor prescribed by Dr. Brown, it's called indomethacin. It's 15 milligram. And the brand name you may have heard of is Indocin. So it's a gout medication. It's a non-steroidal anti-inflammatory drug. So it can help with your gout symptoms. It can relieve your pain.
Okay.
So you are to take it 1 capsule 3 times a day for gout, but don't take it like 2 hours apart. So 3 times a day, like probably 8 hours apart. Like try your best to space them out 8 hours apart. You're taking 3 times a day.
Okay.
You take it with a full glass of water, and some side effects with this medication, it's nausea, vomiting, constipation, diarrhea, headache, and you don't have to worry about those because those are common side effects of this medication. But when you see you have GI bleed, like something that's indicative of GI bleed would be you can see your blood in your stool, some black tarry stew, then you have to contact a doctor right away. Also, don't take any over-the-counter aspirin like Motrin, and don't take aspirin because those are also called non-steroidal anti-inflammatory drug, which is the same class as this gout medication you'll be taking.
Okay, and it's gonna help the pain. That's all. That's really all I'm worried about. Is I just need to do something about it.
Right. It's gonna help with the pain.
Sure.
Just also report symptoms if you have like shortness of breath or chest pain. Then report your symptoms right away to your doctor and seek medical attention right away.
Okay.
So just to make sure I get everything, do you mind repeating the instructions?
Yeah, sure. As long as I just get the medication quick. You said it's Indocin. I'm taking a capsule 3 times a day.
Correct.
And it should help relieve the pain. And then like if I notice like blood in my stool or something like that, I'll call my doctor. And then I might get like a headache or something like that as part of the medication. I should avoid taking other said NSAIDs, I think.
Right, and
Yeah.
sense.
Okay. I'll try to not take anything else to avoid any issues.
Like Motrin, ibuprofen, which is Motrin, and
Okay.
Advil, those kind of stuff.
Okay.
And do you also have like a minute? I know that you're here for your gout medication, but I also see that you have a past medical history of high cholesterol, and you're taking atorvastatin and Lipitor to help with the cholesterol. I hope you don't mind me talking about this with you. And you also, I see that you also have junk food almost every day of the week. And
Yeah, I'm just I'm really busy, like
right.
going between work and that. Like I just grab whatever I can. I don't have a ton of time to try and devote to finding food every day.
Right, I understand that. Actually, if the junk food, it's gonna help build up your cholesterol. So even though you're on the cholesterol medication to help control your cholesterol, it might build up the plaques in your blood vessels again. It might build up the cholesterol again. So I know that you're a really busy man and you don't have time to like get like food to cook every day. Maybe try and like cut out the junk food, like not have it every day of the week. Maybe like try to cut back gradually, and when you can completely like avoid junk food, that would be the best to help with the decrease the cholesterol.
Okay, I'll try.
Yeah. Okay, I hope you feel better. And again, my name is Natalie. I'm here till 9 o'clock, and you're welcome to come in again or call us if you have any questions. I hope you feel better,
All right.
Mr. Rogers.
Thanks, Natalie.